Hey guys, assalamu alaikum. It's Dr. Faraz Ahmad, and today in this video I am going to tell you about types of letter which come in OET writing exam. So this is very important and very helpful video in which I have explained that how many types of letter which come in OET exam. So let's move forward. As you all know about three types of letter which come in OET exam writing subtest. Most of the time, I think more than 90% of the time, referral letter come in OET writing exam, and it has been seen that about 5 to 10% of the times, discharge letter also came in OET writing subtest. And once in the history of OET, I think for doctors, there came a transfer letter as well. Guys, you know what usually transfer letter come for nurses, but in past years one letter was also there for doctors as well, which was a transfer letter. So let's move now. Now I will tell you about referral letter, what and how we can write referral letter, what is transfer letter, how we can write transfer letter, and what is discharge letter, and how we will write this letter. So guys, before telling you how to write referral letter, let me tell you that there are two types of referral letters which usually come in OET exam. Sometimes it is a simple referral letter, and sometimes there come a letter which is emergency referral letter. So both letters, that is a non-emergency referral letter and emergency referral letter, we write in different ways. So let's read it. Referral letter. There are two types of referral letter which come mostly about more than 90% of the cases in OET writing subtests. The proper understanding and differentiation is really a key in writing. So the differentiation is really a key between emergency referral letter and simple or non-emergency referral letter. So let's move forward. So now I will tell you that how we can write simple or non-emergency referral letter. So the differentiation between non-emergency and emergency referral letter is a key. The key is that while you are reading case note, you can check from the writing task that if emergency referral to an emergency department is given in the writing task, then definitely it would be an emergency referral letter. Otherwise, it would be non-emergency referral letter. If address given in the your task in your case note is given is of emergency department, then definitely this would be an emergency letter as well. So I will make a separate video how to differentiate between emergency and non-emergency case note. So I will tell you when I will upload that video. So in this video, my basic aim is that I will tell you about the structure of non-emergency referral letter and emergency referral letter. So if your letter is non-emergency, you are simply writing a referral letter. So you will write address first of all, then introductory paragraph. So both address and introduction are same in emergency and non-emergency referral letter. So in non-emergency or simple referral letter, after introductory paragraph you will write social history paragraph. In social history paragraph, we will write only relevant past medical, past surgical, family history and personal history. And after social history paragraph, that is body 1 paragraph, then we will write the visits in a chronological order. That's mean in body 1 we will mention initial visit. In body 2 we will mention following visit after first visit, like second visit, third visit and fourth visit. So in the third paragraph, which would be body 3, we will write final or today's visit. So this template is really important for non-emergency referral letter. Like you will write address, introductory paragraph, social history paragraph, then initial visit, following visits, and then in the third paragraph of body of letter you will write final or today's visit. Then after today's visit we will write conclusive paragraph and salutation at the end. So in emergency referral letter, the key difference is here that address and introductory paragraph would be same like non-emergency. But in non-emergency referral letter, after introduction we write social history paragraph. But in emergency case, because this is emergency and we are going to refer patient on urgent basis, so after introduction we would write today's visit, which is most important visit in emergency letter. Okay, so this is really important that in an emergency referral letter, after address and introduction you have to write today's visit. Then in the second paragraph of body of letter, then we will write initial visit and following visits. So here come a difference as well, like in non-emergency referral letter we write social history paragraph after introduction, but in emergency referral letter we will write social history paragraph after mentioning today's visit and the rest of the visit, like before conclusive paragraph. Then after social history paragraph, conclusive paragraph and salutation. This is the same as non-emergency referral letter. Fine. So here is the comparison. In non-emergency referral letter address, emergency referral letter address is same. Secondly, we will write introduction paragraph in both cases. In non-emergency referral letter, after introduction we will write social history, but in emergency referral letter we will write body, that body one, that means today's visit. Then after mentioning the visits, we will write in non-emergency referral letter conclusive paragraph, but after mentioning the visits in emergency referral letter we will write social history paragraph, then conclusive and then salutation. So before writing a letter in a proper way, that is either emergency or non-emergency, we have to keep in mind this template. This is very important. So this was all about referral letter, that's mean non-emergency and emergency referral letter. So second type of letter which come in OET exam, that is a discharge letter. So guys, first of all, before telling you the template of discharge letter, I want to tell you a point which you have to keep in your mind. The point is, as you're referring your patient, I am sorry, as you are discharging your patient to the local doctor, to the local GP of the patient, and local GP knows everything about patient, because patient came from that local GP. So local GP always knows about past medical history, social history, personal history, any surgical history. So there is no need to mention social history paragraph in discharge letter. This is very important key point, and you have to keep this in your mind. So let me tell you now a template of discharge letter. That is, first of all you will write address, this is same, write rest of the letters. Then you will write introductory paragraph, this is also same like referral letter. So then after introductory paragraph, no need for social history paragraph in discharge letter. You have to keep this in your mind. So after introductory paragraph in discharge letter, you will mention everything about the hospitalization. That's mean what happened with the patient, which brought your patient to the hospital, and what was done with your patient. That mean the management in the hospital, any procedure that was done in the hospital, and any nursing care that was really important for in the hospital. Okay, after mentioning the hospitalization paragraph in brief detail, then you will write today's status or current status of your patient. That's mean your patient was hospitalized, you have done some procedure, and now you will write today's status about the today's condition, like today on today's assessment patient was stable and his condition is improved. So after mentioning today's status, then we will write conclusive paragraph, and after conclusion we will write salutation, that is same like referral letter. So you have to keep in your mind six things in discharge letter: address, introduction, hospitalization, today's current status, conclusive paragraph, and salutation. So that's all about discharge letter. So let's move forward. So this is the third type of letter which come in OET exam, that means transfer letter. So basically, what is transfer letter? Transfer letter came in a scenario like patient came to you, you did a procedure for him, and after doing the surgery or some other treatment, now patient need rehabilitation. Patient needs some other management, like from physiotherapist, like from pulmonary rehab, or like in this way. So this type of letter which usually come in transfer letter. One other type of letter also came in transfer letter, like a patient was admitted in emergency department, then a patient was transferred to medical department, but there on the complete workup, after complete investigation, it was found that the patient basically belongs to cardiology ward. So this transfer also occur between the wards. So let me tell you that how you can write transfer letter. First of all, address same like like discharge and referral letter. Then introduction is same as well like previous letters. Then here come the social history paragraph. Just write simple things, only relevant information. Okay, social history paragraph, only relevant information. Let me give you an example. Like if you are going to refer your patient to a physiotherapist, then you will tell your physiotherapist only about the relevant information from past medical, past surgical history. Address, introductory paragraph, social history paragraph, then hospitalization. What was the chief complaint, treatment given, any procedure or recovery status, and current status of the patient. Then after the hospitalization paragraph, now you will write your transfer plan. Like let me give you an example, that a patient came to you, you did a total knee replacement surgery, and after surgery your patient remain in the hospital for 3 weeks. Now you are going to transfer your patient to a physiotherapist for the rehabilitation of her knee movement. So you will write clearly in your letter about the transfer plan. Okay, then after mentioning the transfer plan, you will write conclusive paragraph and salutation. So guys, this is all about transfer letter. So what I have told you in this slide, that usually 4 types of letter come in OET exam. Number 1, referral letter, emergency referral letter, discharge letter, and transfer letter. So most of the time referral letter, either a simple referral or emergency referral letter come, then 5 to 10% of the cases there come a discharge letter as well. But very few times, 1 or 2 times I think, transfer letter also came in OET exam. So if you follow these templates which I have just mentioned in the video, I can assure you that you will be able to write at least 380 marks in your reading sub test. So thank you very much for watching this video. Please try to follow these templates, and please also subscribe to my channel for new videos as well. Thank you very much. Bye bye.